Hello, my name is Felicity, and I will be using the SNAPS method to present a case study. So, starting with summarize, Katie Martin is a new patient who presents to the clinic for an annual exam. She is in good health with no known past medical history except chickenpox at age 12. She is up to date on vaccinations. Her medications include oral contraceptive. She is a current smoker. Her last pap smear was in the last year, and her last well visit was at age 15. Her last menstrual period was 2 weeks ago, and she has one sexual partner, which is her boyfriend of 6 months. Family history includes alcoholism with her father. Her parents are currently divorced. The patient does not exercise, and she doesn't have a well-balanced diet. She currently lives with her boyfriend, and she reports that they argue frequently and that this is exacerbated by the boyfriend's alcohol intake. She really doesn't have a support system. Her family lives far away, and she reports that her friends are afraid of her boyfriend. She also reports some financial struggles. Her physical exam, her vital signs are stable. She is afebrile. Patient is thin and pale. No ecchymosis is noted anywhere. She has no signs of trauma. Her lungs are equal and clear bilaterally. S1 and S2 is auscultated. She is alert and oriented. Reflexes are 2+. But she does have poor eye contact. Her depression scale, electrolytes, liver enzymes, renal function panel, and cholesterol is with normal limits. So for narrow, I chose 2 different differential diagnoses, and that's domestic violence and depression. So to analyze these differential diagnoses, starting with domestic violence, there is some evidence that this is going on, even though the patient hasn't exactly said this, but some evidence is that she does report her boyfriend getting jealous, and he doesn't want her to talk to or hang out with friends unless he is there with her. He checks up on her while she is at work. The patient reports friends are afraid of her boyfriend. He forces her to have sex when she doesn't want to. He does not want her to pursue her college education. She reports that they argue frequently, and that he becomes mean when he drinks alcohol, which she tells us that he drinks about a 6-pack a day. For the differential diagnosis of depression, some evidence is that she's missed work recently for personal reasons. Her family lives out of town. She's lost contact with her friends, so she really doesn't have a support system. The decreased eye contact during the exam, boyfriend and her arguing frequently, and it kind of sounds like she had a rough life growing up. She reports her parents arguing all the time. Her dad was an alcoholic, and he was abusive towards her mother. She tells us that she smokes cigarettes to decrease her stress, and that she's very fatigued, feels tired most of the time, and her poor diet also reflects that she might have some depression going on. The thing that I am wondering is that we actually did a depression screening, and she was negative for that. So for the probe section, my question would be, if everything about what the patient is saying in the physical exam is pointing towards the patient having depression, but she has a negative screening, how do we interpret that as the provider? Is it more important to focus on what we think is happening, or is it more important to focus on this screening tool. She also denies her boyfriend has physically hit her, but from everything that she's reported, isn't this still domestic violence? Another question would be, if she wants to stay with him, do we support that decision as the nurse practitioner, or do we try to make them come to the realization of what's going on? It's also hard because there's always two sides to every story. Obviously, in this case, it's very obvious what's going on, but in other situations, how do you tell what is really going on in the household? Some other differential diagnosis could also be substance abuse. In the case study, it wasn't directly asked if the patient had any history of substance abuse or alcohol abuse, which could also be another reason that she's frequently missing work. She also has poor dietary habits, and she also has alcohol abuse. So for plan management, the domestic abuse or the violence assessment, we need to educate the patient. We need to give her resources, whether she wants help or not. We need to make sure that she knows crisis centers that are around, hotline numbers, women's shelters, just in case things escalate and get worse. We need to make sure that we set up a follow-up appointment in 1 month, mainly because she is in danger, what we feel is in danger, because of everything that she describes going on in her home life. We also need to ask her about her missing work recently. Is there anything that we can do for her to prevent this from happening? If she could explain why she's missing work, if maybe there's an underlying condition going on. Educating her on exercise and better diet to help her feel better and not as fatigued. We also need to set up that tetanus booster within the next year, since it has been 9 years since her last. And then we also need to see if she's open to talk about tobacco cessation. So for the selecting the issue, we need to know, we need to be a resource for the patient. So what do we do to help or support someone who doesn't want help? So let's say that we try to talk to her about the domestic violence and possibly leaving the boyfriend. What do we do if she doesn't want that? What if she doesn't want that help? How do we emotionally and mentally support patients who aren't ready for this step? So my question for you is, what do you think I need to research more of? Do you have any suggestions to the questions I've asked? Have you dealt with this as a nurse? And what did you do to help that patient?